Tips for living a healthier life. Let's talk about diabetes today. Diabetes is a disease affecting the manner in which the body handles digested carbohydrates. If neglected, diabetes can cause extremely severe health complications, ranging from blindness to kidney failure. Diabetics have a high level of blood glucose. Blood sugar level is regulated by insulin, a hormone secreted by the pancreas, which releases it in response to carbohydrate consumption. Insulin causes the cells of the body to absorb glucose from the blood. The glucose then serves as fuel for cellular functions. Traditional diagnostic standards for diabetes have been fasting plasma glucose levels greater than 140 mg/dL on 2 occasions, and plasma glucose greater than 200 mg/dL following a 75-gram glucose load. However, even more recently, the American Diabetes Association lowered the criteria for a diabetes diagnosis to fasting plasma glucose levels equal to or higher than 126 mg/dL. Fasting plasma levels outside the normal limit demand further testing, usually by repeating the fasting plasma glucose check and, if indicated, initiating an oral glucose tolerance. The many symptoms of diabetes include excessive urination, excessive thirst and hunger, sudden weight loss, blurred vision, delay in healing of wounds, dry and itchy skin, repeated infections, fatigue and headache. While suggestive of diabetes, these symptoms can also be caused by other factors, and therefore anyone with symptoms suspicious of the disease should be tested. While genetics and environmental factors play a role, the exact cause of diabetes is as yet undetermined. However, one thing is precisely clear to those with this condition: eating right is vitally important. Generally speaking, people with diabetes do not eat a standard one-size-fits-all diet. Rather, they must adhere very closely to the healthy eating guidelines prescribed by their doctor. There are two different varieties of diabetes. Type 1 diabetes, or juvenile diabetes, also known as insulin-dependent diabetes. The cause of type 1 diabetes starts with pancreatic inability to make insulin. This causes 5 to 10% of cases of diabetes. The pancreatic islet of Langerhans cells, which secrete the hormone, are destroyed by the patient's own immune system, probably because it mistakes them for a virus. Viral infections are believed to be the trigger that sets off this autoimmune disease. Type 1 diabetes is most prevalent in the Caucasian population and has a hereditary component. If untreated, type 1 or juvenile diabetes can lead to death within 2 to 3 months of the onset, as the cells of the body starve because they no longer receive the hormonal prompt to absorb glucose. While a great majority of type 1 diabetics are young, hence the term juvenile diabetes, the condition can develop at any age. Autoimmune diabetes is diagnosed by an immunological assay which shows the presence of anti-insulin, anti-islet cell antibodies. Type 2 diabetes, non-insulin-dependent diabetes, also known as adult-onset diabetes. This diabetes is a consequence of body tissues becoming resistant to the effects of insulin. It accounts for 90 to 95% of cases. In many cases the pancreas is producing a plentiful amount of insulin. However, the cells of the body have become unresponsive to its effect due to the chronically high level of the hormone. Finally, the pancreas will exhaust its overactive secretion of the hormone, and insulin levels fall to beneath normal. A tendency towards type 2 diabetes is hereditary, although it is unlikely to develop in normal weight individuals, eating a low or even moderate carbohydrate diet. Obese, sedentary individuals who eat poor quality diets built around refined starch, which constantly activates pancreatic insulin secretion, are prone to develop insulin resistance. Native peoples like North American Aboriginals, whose traditional diets never included refined starch and sugar until these items were introduced by Europeans, have very high rates of diabetes, 5 times the rate of Caucasians. Blacks and Hispanics are also at higher risk of the disease. Though type 2 diabetes isn't as immediately disastrous as type 1, it can lead to health complications after many years and cause serious disability and shortened lifespan. As with type 1 diabetes, the condition develops primarily in a certain age group, in this case patients over 40, which is why it's typically termed adult-onset diabetes, However, with the rise in childhood and teenage obesity, this condition is being seen for the first time in school children as well. If treatment is neglected, both type 1 and type 2 diabetes can lead to life-threatening complications like kidney damage, nephropathy, heart disease, nerve damage, neuropathy, retinal damage and blindness, retinopathy, and hypoglycemia, drastic reduction in glucose levels. Diabetes damages blood vessels, especially smaller end arteries, leading to very severe and premature atherosclerosis. Diabetics are prone to foot problems because neuropathy, which afflicts about 10% of patients, causes their feet to lose sensation. Foot injuries, common in day-to-day living, go unnoticed, and these injuries cannot heal because of atherosclerotic blockage of the microscopic arteries in the foot. Gangrene and subsequent amputation of toes, feet or even legs is the result for many elderly patients with poorly controlled diabetes. Usually these sequelae are seen sooner in type 1 than type 2 diabetes, because type 2 patients have a small amount of their own insulin production left to buffer changes in blood sugar levels. Type 1 diabetes is a severe disease and there is no known permanent cure for it. Nonetheless, the symptoms can be controlled by strict dietary monitoring and insulin injections. In theory, since it is induced by diet, type 2 diabetes should be preventable and manageable by dietary changes alone. However, as so often happens, clinical theory is defeated by human nature in this case, as many diabetics, and many obese people without diabetes, find it personally impossible to lose weight or even stick to a diet free of starchy, sugary junk food. So type 2 diabetes is frequently treated with drugs which restore the body's response to its own insulin, and in a few cases injections of insulin. Diabetes and exercise. Exercise causes the body to process glucose faster, which lowers blood sugar. The more intense the exercise, the faster the body will utilize glucose. Therefore it is important to understand the differences in training with type 1 and type 2 diabetes. It is important for an individual who has diabetes to check with a physician before beginning an exercise program. When training with a diabetic, it is important to understand the dangers of injecting insulin immediately prior to exercise. An individual with type 1 diabetes injecting their normal amount of insulin for a sedentary situation can pose the risk of hypoglycemia or insulin shock during exercise. General exercise guidelines for type 1 are as follows: allow adequate rest during exercise sessions to prevent high blood pressure, use low-impact exercises and avoid heavy weight lifting, and always have a supply of carbohydrates nearby. If blood sugar levels get too low, the individual may feel shaky, disoriented, hungry, anxious, become irritable or experience trembling. Consuming a carbohydrate snack or beverage will alleviate these symptoms in a matter of minutes. Before engaging in exercise, it is important for blood sugar levels to be tested to make sure that they are not below 80 to 100 mg/dl range and not above 250 mg/dl. Glucose levels should also be tested before, during, after, and 3 to 5 hours after exercise. During this recovery period, 3 to 5 hours after exercise, it is important for diabetics to consume ample carbohydrates in order to prevent hypoglycemia. Exercise will greatly benefit an individual with type 2 diabetes because of its positive effects on insulin sensitivity. Proper exercise and nutrition are the best forms of prevention for type 2 diabetics. It is important for training protocols to be repeated almost daily to help with sustaining insulin sensitivity. To prevent hypoglycemia, progressively work up to strenuous activity. As with individuals with type 1 diabetes, carbohydrates should also be present during training to assist in raising blood sugar levels if the day becomes low. Please note that this article isn't a substitute for medical advice. If you suspect you have diabetes or even are in a high-risk demographic group, please see your doctor.